Hi, this is Margaret. I hope you're all well. I've been doing some Facebook Live instead of YouTube for the past couple months, but now I'm back. We're going to start talking today about a very serious health condition that can cause heart attacks and even motor vehicle crashes. What could that be? It's sleep apnea, which means stopping breathing while sleeping. And it's characterized by snoring, restlessness, and snorting during sleep, and you stop breathing and you wake yourself up, but not enough to really remember. And so you're not rested, you can wake up with a headache, and then during the day have sleepiness, tiredness, and poor concentration. And with all this stopping breathing, you're depriving your brain of oxygen, and that leads to all kinds of problems because your brain's the control center of your whole body, and you can have poor thinking skills from this. Also diabetes, depression, drowsy driving, motor vehicle crashes, and heart attacks. Now, sleep apnea is the most common sleep-related breathing problem, and it affects, in North America, 15% of men and 5% of women. That sounds like a lot. It's pretty common. And these are conservative estimates depending on how you gauge it and grade it when testing for it. And it's more common among African Americans under age 35 than Caucasians of the same age. And there's certain risk factors, being male, age, so that as you get older, the risk goes up and plateaus at age 70 or so. And also obesity is a risk factor, so a person who gains an additional 10% of weight can be 6 times more likely to get sleep apnea. And also certain medical problems are at risk, such as if you have heart failure, chronic lung disease, polycystic ovarian syndrome, hypothyroidism, PTSD, or a stroke. You should get checked for sleep apnea. And smoking is also a risk as it aggravates some of the other related issues. And it can also run in families or be related to a chronic nasal congestion. Sorry, my dog's walking around, so I'm watching out for him. And the way to get checked for this, because I'm sure there's people listening and watching who wonder, you take a sleep test either at a sleep lab or in your own home, and your healthcare provider would decide which one is the best thing for you to do. And so you might think, well, how do I know about if I should really get checked? I don't know if I snore, I live by myself. What you can do is take a survey of sleepiness. It's called the Epworth Sleepiness Scale. And I wrote that down because I think it's really, really important. You go online, find the PDF, take the survey, and if your score is greater than 10, chances are you have sleep apnea. So thanks for listening. The reason I'm really highlighting this is I know I talk a lot about sleep, and sleep is really, really important to life, as you can tell, because if you're not getting your sleep from having sleep apnea, it really affects your health overall, like your mood, your physical health. So it's pretty important. I hope that this has been helpful, and I'll see you all next month, and goodbye.